And the third vital sign that we kind of care about here is blood pressure. Blood pressure is the actual pressure that's exerted on the arterial walls when the heart either contracts or is at rest. So it's what is the pressure in the arteries. So the systolic blood pressure is the pressure on the arterial wall when the heart is squeezing. So systolic, squeeze. Diastolic is the other one. It's the pressure on the arterial wall when the heart is at rest. So it's reported as the systolic number, which is higher, over the diastolic number, which is lower, or 120 over 80. This is kind of your typical normal for adults. And there are two different ways that we can assess blood pressure. We can auscultate, which means we actually listen for the pressure. And we can get both the systolic and the diastolic values this way. We can also palpate the blood pressure. We can actually just feel for the pressure. And the problem with this is we only get a systolic number. In an adult male patient, the average blood pressure is 100 plus the age up to about 50 over 80. In females, it's 90 plus the age up to 50 over 80. So remember, this is your systolic, and this is your diastolic. In a child, it's anywhere from 94 to 100 over 56 to 64, and this will be dependent on age and size. An infant at birth is going to be 60 to 80 over 40 to 76, and at 6 months, it's about 90 systolic over anywhere from 40 to 76. But here's one that I think is much more important here, which is the minimum systolic blood pressure. In adults, generally speaking, the minimum systolic blood pressure that we want to see is right about 100. So remember, the systolic is on the top. So this is the pressure when the heart's squeezing. We want the heart squeezing pressure, the systolic, to be 100 in adults. And in children, it's going to be 70 plus 2 times their age in years. So if we have a 5-year-old, it's going to be 70 plus 2 times 5, which equals 70 plus 10, which equals 80. So the minimum systolic blood pressure for a 5-year-old is 80. Here are another couple of terms. Hypotensive, hypo now is low, so that's low blood pressure, and hypertensive is high, so it's high blood pressure. We can sometimes estimate blood pressure by where do we have pulses present, and this is kind of a concept I want you guys to really understand. It's possible that we can have a patient who's very sick, so very sick patient, and they're still alive, so they still have a pulse, but they may not have a radial pulse. So here's what we can say. If the radial pulse is present, we can estimate that your systolic blood pressure is at least 80. Maybe. This really depends on the patient. But if you're getting enough blood flow that you can feel a pulse at the radial, then they're probably doing okay. It may not be awesome, but they're getting blood all the way out to their hands and all the way down to their feet if they have a radial pulse present. As far as reassessing your vital signs, if they're unstable, it's every 5 minutes. And if they're reasonably stable, then it's every 15 minutes. But here's the thing. Don't treat numbers, treat people. It may be that you have a petite individual whose blood pressure, while they're sitting on your stretcher, wide awake and complaining of a stubbed toe, is 90 over 60. That may be normal for the patient. If the patient doesn't have any signs that they're suffering with a blood pressure of 90 over 60, then it's not a big deal. So we're going to treat the people, not the numbers. One of the other key things to assess when you're looking at vital signs is perfusion. And perfusion is blood, which carries nutrients and oxygen, getting to where it needs to go, or getting to all of the cells. When our body experiences a problem, it could be somebody having a heart attack, or maybe somebody has been in a car accident and they're bleeding on the inside. The body has compensatory mechanisms to make up for the fact that they are bleeding. And one of the things that happens is that your body can kind of shut down some of the areas of blood flow. One of the most common places for this to happen is to the skin. The skin really does okay without having too much blood flow. It's going to survive. So the body will take and reduce the perfusion out to the skin if it needs the blood somewhere else. This is going to make the skin actually look pale. Blood does have a red kind of hue to it, and that's part of what gives our skin the color that it has, is the blood that flows to the skin. So if somebody is pale, their skin is not getting perfused. Also, what's going to happen with that is it'll be cool. There's no warm blood going out to the skin, so their skin will feel cool. We can also assess the capillary refill. I've discussed this a little bit in the assessment lecture, but basically, take and pinch your nail bed, and then let it go. When you pinch your nail bed, it should blanch out underneath your nail, meaning it'll turn kind of whitish. When you let it go, the blood will start flowing back in, and it'll go back to being a pink color. That's the little capillaries in your nail bed refilling. It should be less than 2 seconds. So that's one of the other ways we can assess for cap refill, although this is best in kids. Skin color and temperature, best in adults. Although it's perfectly present in kids as well, but you'll see some capillary refill issues sooner than skin issues. So the skin color should be pink. It could also be flush. It could be pale. It could be cyanotic. It could be jaundiced, which is yellow. And you'll see this really in the whites of the eyes. The sclera will be yellow. It's an arrow there. Skin temperature, hot, warm, cool, cold. Warm would be the normal. Capillary refill, like I said, it could be less than 2 seconds or greater than 2 seconds. This is, of course, the good one. So that's it for vital signs. I know I didn't talk too much about how to check them, but we're going to go over that in class. So review kind of the basics of them and look at the skill sheets. And when you come to class, be ready to learn about vital signs. Thank you.